So a healthcare provider has received report from a off-going shift that a client is confused and has been identified as a high risk of fall. So our patient confused, key point, also identify high risks of fall. So during the planning of treatment or intervention, our priority is safety. How to prevent the fall? The nurse share this information with the unlicensed assistive personnel, UAP, which finding by the nurse require intervention. So what UAP are doing, if UAP do something wrong, as a healthcare provider or RN, we have to correct them, right? UAP stand for unlicensed assist personnel, or we call certified nursing assistant or CNA. So basically, the role of UAP provide the routine non-skilled care such as bed bath or bed making, routine vital sign check, and also putting the enema, right? What else? Sometimes UAP also do oropharyngeal suctioning. So again, I said the non-skilled care. So now my patient confused high risks of fall, and RN can do something, educate the UAP, and UAP did out of 4 response, which one is something wrong? As a LPN or RN, you have to educate them. Number 1, UAP has attached the bed alarm to the client ground and bed. So attached the alarm, confused patient, you can recall them, nothing bad, non-skill work. It is the responsibility for UAP. UAP has making hourly routine to the client. It is for the safety. Hourly can survey, visit the patient. Nothing wrong. UAP has lowered the bed. It is okay. But second portion said, raise all 4 side rails. So if you raised up 2 corner, 2 side or 3 side, it is not a restraint. But when you raised up 4th side at the same time, it indicates, it does mean you restrained your patient. And you know, when we need to restrain a patient, we always need doctor order. UAP never can do this. LPN never can do this. In any emergency, RN can do this with a phone order by the doctor, and doctor must come and check within 24 hours. So UAP allow the bed, it's okay, but the second portion is not okay. Raised all 4 sides, it indicate restraint putting. So as a RN, you have to educate your patient, your UAP, that you are doing something wrong. Number 4, UAP has placed the fall risk ID bracelet on the client wrist. Nothing wrong, okay? And let me read their explanation. Placing the client's bed in the lower positioning is appropriate, but raising all side rail is considered a form of physical restraint. Having all four side rail up may actually increase the client's risk for fall, as they may try to climb up and over the rail. Raising two or three side rail is appropriate. The nurse should lower at least one side rail. Should lower at least one side and communicate to the UP that having all four sides is inappropriate. Doing something wrong, we need to correct it. What are the education objectives? The nurse should ensure that multiple interventions are put in a place for a client high risk of fall. That include placing the bed in the lowest position with two or three side rail up. It can prevent the fall. Identifying the client with the fall risk by the ID band, also good for your patient, nothing wrong. Using the bed alarm and also frequent round on the client, it is also for safety for the patient. Question here, a comatose client in the intensive care unit has an indwelling urinary catheter. So our patient is a comatose, under the coma or unconscious. They're not able to passing the urine. So in that scenario, we have to put the urinary catheter. So the question here, which action should be nurse implement to reduce the incidence of catheter associated urinary tract infection? So urinary tract infection, the indwelling catheter is one of the underlying risk factor of develop the UTI. So in this question, they said, what step by step we should follow to prevent the catheter associated UTI? Number one said, the cleaning the periurethral area with antiseptic every shift. It is very important, every shift cleaning the periurethral area, but we do not need antiseptic. Guideline does not say that. According to the guideline, we could cleaning the periurethral area with a soap and water. So it is not an answer to prevent the UTI. Ensure each client has a separate container to empty the collecting bag. It makes sense. If we use the same container, it will be easily contaminated. So we must use the separate container to empty the collecting bag. Keep the catheter bag below the level of bladder. So you see in this picture, the patient undergo taking the urinary catheter, having it. So this is the urinary bladder and bag is there. So bag must be below the level of urinary bladder, right? And routinely irrigate the catheter with antimicrobial solution. Again, I said no guideline, no book said irrigate the catheter with antimicrobial solution. Use the sterile technique when collecting a urine specimen. Yes, as a healthcare provider, we must know, we must follow the sterile technique when collecting the urine specimen for any kind of urine microscopic examination or urine culture for appropriate antibiotics. So number 1 and number 4 is not correct because we do not use the antiseptic, we do not use the antimicrobial solution. What next? Here, healthcare catheter-associated UTI are prevalence among hospitalized clients. Right. So in hospitalized client, patient when use the catheter has a chance to develop UTI prevalence. What are the step-by-step procedure we could follow to prevent infection in the client with urinary catheter? There are step-by-step process. Let me read it. First of all, wash the hand thoroughly and regularly. And you must know, washing hand can prevent 95% infection. And when you washing hand, it would be at least 10 to 20 seconds. And perform routine perineal hygiene with a soap and water. In this question, mentioning antiseptic, no, only soap and water. Keep the drainage system off the floor and contaminated surface. Keeping drainage system off. Keep the catheter bag below the level of bladder, like this picture we saw before. Ensure each client has a separate clean container to empty the collection bag and measure the urine. And use the sterile techniques when collecting a urine specimen. And also facilitate the drainage of urine from tube to bag to prevent the pooling of urine in the tube or backflow into the bladder. Avoid the prolonged kinking, clamping, or obstruction of the catheter tubing. So we have to avoid the clamping or kink. So this is the tube. We do not make it bending, or we do not kink or clamping. Ensure the oral fluid intake in the client who are awake. And also secure the catheter is following all of the rules and regulation by hospital policies. Inspect the catheter and tubing for any kind of integrity. Also, the secure is connected well. What are the education objectives about the catheter? Routine catheter care to prevent the healthcare catheter-associated UTI include routine hand washing or hand washing hygiene, cleaning the perineal area with soap and water routinely, keeping the catheter bag below the bladder and off the ground, and keeping the catheter and tubing free of kink, and also facilitating urine into the bag and using the sterile procedure. when collecting urine specimen. It is very important for NCLEX board exam. So a 2 years old who is swallow an overdose of adult cough syrup. So our patient is only 2 years old and came to the hospital because of swallow overdose of adult cough syrup. You know, the cough syrup is a sweet stuff. Children love it to drink or eat, and is being discharged from emergency department. The patient say to the nurse, from now I'm going to store all medication in the top dressing drawer. Which is the best response by the nurse? There are 4 options, right? So can you lock your dresser drawer? Can you lock it? Or option number 1. 2, make sure all of your medication have a child-proof cap. That sound like a safe plan. And number 4, you need to keep an open eye to your child at all the time. Number 4 is not possible 24 hours, 7 days a week to keep eye open at the child, right? And number 3, the sound like a safe plane. Definitely it is not 100% safer. Make sure all of your medication has a child-proof cap. It is good, but out of 4, number 1 is the best. If you keep it locked inside the locker, right, it would be out of the children. Children are not able to reach it out. So number 1 is the best choice. So children naturally very curious and attracted to the medicine, especially if it is sweeter or syrup-like many over-the-counter cold product. They usually find the medicine when exploring their environment and getting into everything when no one is watching. Children may find medicine in a patient's coat pocket or under the counter cabinet or on a nightstand. Even if a drug is stored in a place that seems out of reach, children can climb up on the chair or stool to reach it. Medication are the leading cause of child poisoning, right? So it is very important to take care of it. The best prevention measure include the placing all medication out of sight, placing them in a drawer or cabinet with a child-proof lock, and putting them away after each use. It is the best option for uh, save the medication from the children and prevent the poisonous accident. What are the education objectives? The most important strategy to prevent accidental drug overdose in the children is teaching the parents and caregiver to keep medicine out of sight and in a locked drawer or cabinet. Parents or caregivers should also be advised to put the drugs away after each use. Important for NCLEX board.